Hey there, families. I want to come on here and talk about breastfeeding today. So it's Rachel with Drug Free Birth, and you may be in one of my classes or you may just be browsing this. And I want to talk a little bit about those first hours up to those first weeks and months of your new baby and how to get off to a good start when it comes to breastfeeding. So, if you've taken class with me or if you've read up on breastfeeding, you probably understand there's so many benefits to breastfeeding. There's a reason why they say breast is best, and that there are lots of papers out there, lots of articles, lots of opinion pieces on why breastfeeding is really so good for the baby. And our bodies are doing the right thing by making the milk. And how can we maximize this? And how can we get breastfeeding started in a way that will help keep our supply up and help ensure that we don't have to rely on outside sources or even formula later if we don't want to do that. So let me talk a little bit about a book that I recommend a lot to my students, and that is this book here. It's by La Leche League International. It's called The Womanly Art of Breastfeeding, and this is a wonderful book. I have found this on Amazon and online, but also I see this in the library quite a bit. So you are probably going to be able to find this and many of the different editions pretty easily. So I encourage you always to buy a book like this rather than just to get it at the library if you think you're going to be utilizing that, say, for your child, because you'll be able to highlight and mark it up and dog ear and all that stuff. And also, this is kind of a book what I call like a bathroom reader, in that you can kind of just flip over to any page and really get a lot out of it. Um, so if you are expecting a child, I would encourage you to explore this if breastfeeding is something that's going to be one of your priorities. So let's talk a little bit about um, those first minutes after baby is born. Okay, so you've already noticed as a pregnant mommy that you're feeling breast tenderness when it comes to just being pregnant. That's just one of the symptoms of pregnancy. And it's because your breasts are getting ready to start making milk. And the milk ducts are getting ready to start expressing milk. You may have even noticed that you can express a little bit of fluid, what we call colostrum. And I'm going to talk a little bit about what this colostrum is and why we have that. Okay, so you'll notice in this book, if you end up reading it, that there's kind of one main thesis here, um, maybe two main theses. So one of the theses is that any amount of breastfeeding is good. What they say is that if you breastfeed for 1 minute, 1 hour, 1 day, 1 week, 1 month, 1 year, it's all good for your baby. It's all good. So there's no judgment. I really like that philosophy because it is all good. Now, you might have in your mind an ideal. Maybe you want to breastfeed for 6 months. Maybe you want to breastfeed for a year. Maybe you want to breastfeed for 2 years. Whatever it is that you have as a goal, you can achieve that. And this book is really going to help outline how to do that. But one of the main theses is that um, all milk is all breast milk for however much time is good for your baby and it's good for you. Also, the other main thesis of this book is that milk out equals milk in. Okay. I know that out in the shops, in the specialty shops, in the retail shops, there's all kinds of products on maybe certain herbs you might use. I've seen oatmeal being touted. I've seen certain teas be promoted. I see these milk production like cookies out on the market, and I'm sure they all have some benefit for sure. But a woman cannot just eat a ton of these uh, lactation cookies, for example, and breastfeed infrequently and have the same good outcome that she would if she only exclusively just breastfed frequently. Okay. So a woman can also breastfeed frequently. Okay. And never eat a bite of any of these cookies or eat the oatmeal or anything like that. And she'll still experience a good amount of milk for her baby. All right. So I just want to throw that out there as well. So milk out equals milk in. Okay. So let's talk about that first couple of minutes after your baby is born. Okay. So you're in what we call this kind of 2 hour period, what a lot of people call kind of the golden hour of your baby being born. And that's this first 2 hour window where you're being observed, you and your baby are being observed, and that your vitals are being taken every, say, 30 minutes or so. Your baby may be having their first couple of tests being run, baby's being weighed and all of that stuff. Your placenta may or may not have come out just yet, but in that window is when they're going to see that placenta be born. Okay. And a lot of mommies that work with me and that work with certain natural childbirth techniques, they're going to want to go ahead and put baby to the breast right away. Okay. And there's a couple of reasons for this. Certainly, the bonding and the imprinting between mom and baby is important during this time. Now, there's always cases of maybe a baby who needs to spend some time in NICU or something like that. Trust me, the baby's still going to bond with you. Okay. They're going to still know that you're mommy and they're going to still know that daddy's daddy and all that stuff. But of course, the ideal is to go ahead and put baby to the breast right away. Okay, so there's a couple of nuances here. So number one, you want to go ahead and put baby skin to skin as soon as baby is born. Okay, now whether you have baby wiped down, whether you rub that vernix into their skin or ask some of the nurse team to do that for you and wipe some of that off, that's a personal preference. And you can always chat with your provider, your OB, your midwife about the pros and cons of that on your own time. Some moms do, some moms don't. Um, but really having that baby go skin to skin, no matter what, whether they're breastfeeding yet or not, is really great because it's going to help regulate baby's temperature for sure. Okay, so putting baby on a 98.6 chest is really good for helping them regulate that temperature quicker. Okay. So a lot of times moms are going to have baby put on the abdomen or the chest, and then a blanket is going to go over top of both of them. Okay. If dad's going to take a turn at skin to skin, he'll take off his shirt, maybe sit down, have baby skin to skin, and then there's going to be a blanket put on top of them. Okay. It's great for bonding between daddy and baby as well. Okay. So baby is naturally going to have a couple of instincts here. Okay. So number one, you might start noticing that baby's kind of moving that head back and forth. Okay, you'll notice that baby can kind of move that head and neck even from the very beginning. Okay, it's oftentimes thought that babies don't start pulling that head up until weeks after birth. Um, and it's really not true. When a baby is born, naturally, meaning they're not drugged, okay, meaning they're completely sober when they're born, okay, so there's not been any medication introduced to the mom's bloodstream and the baby's bloodstream during birth, then that baby is even more vigorous, okay, even more ready, even more alert to begin enrooting, looking for mom's breast to go ahead and start drinking milk. Okay, so baby's using their sense of smell for this. Okay, and they're also using some of these physical instincts in looking, kind of rooting for that. And you might see baby, let's say you have baby on your chest like this, baby's head might come up and kind of their head might wiggle a little bit. They're kind of looking for the breast. Okay, so oftentimes moms are going to cradle baby, okay, so that that nipple is right there, maybe at their cheek, okay, or right there at the nose. Okay, so oftentimes moms are going to do that, and baby, just in their natural instincts, are going to smell these pheromones, smell mom's natural scent. Okay, and they're going to start not only imprinting there, but they're going to notice, okay, I'm here to eat, I'm here to drink milk. Okay, now when you offer baby the breast, okay, oftentimes moms are going to be trained. They're going to certainly learn it through the book. And a lactation consultant is going to be on staff at your hospital more than likely, and lactation consultant can come in and see how this is being done. babies have another natural instinct in that when their cheek is stroked or their nose is stroked, they're going to naturally open up. Okay, and you'll notice this as you start to feed your baby, even as you start to wean your baby on, maybe onto food. Um, if you kind of tickle their cheek, they're going to naturally turn in that direction. Okay, so you'll notice that with baby. So when the nipple is put right there at the nose or at the top of the lip or on the cheek, baby's going to naturally turn towards there and open up. Okay, so moms, this is your cue to go ahead and put that nipple right there so that they can start to learn to latch. Okay, baby's going to naturally want to suckle at this point. Okay, and it's going to feel a little funny at first, moms, because a couple of things are happening. Number one, as baby starts to suckle, there are cues that are being given to you and your hormones at this point. And it's telling your brain, number one, to go ahead and start releasing what is called colostrum in these early days and eventually milk as baby gets a little bit older in number of days of life. So it's signaling to your breast to go ahead and start releasing this, but it's also signaling to your uterus to start to close up. Now, if placenta hasn't been released yet, if it hasn't been born yet, then it's signaling to your uterus to continue to constrict, aka cramp. Okay, so it's continuing to cramp so that that placenta will be released. Okay. Now, every once in a while, there's a manual help that maybe a nurse or a doctor may provide to help that placenta dislodge sooner than later. Now, in your birth plan, you may place some verbiage that maybe you want to encourage that placenta to dislodge, to be born. By breastfeeding. Okay. And you may want to try that for a certain amount of time before the doctor may intervene. Now, the doctor can intervene with what we call abdominal massage. And that's basically like, your cat might kind of massage, right? Or massage and knead um, a soft surface like they do. And I think that that's actually something that a kitten learns to do to kind of get the milk going on mom. So this is kind of similar, actually. But I promise you, ladies, it's not that comfortable. It actually can feel it can feel painful, to be frank with you. And it is less invasive than maybe issuing and giving some intravenous, say, chemical hormone to have that uterus start to close up and dislodge the placenta. So you might talk to your doctor prior to the big day on what types of techniques they prefer to use to help with that placenta, and then how often or what time frame they typically start to have those conversations and want to start to intervene. Now, in my 3 births that I've had, I can remember having this abdominal massage at least once. It's hard to say actually with the other ones if I needed that. So it could be that the placenta was able. I think with baby number one, the placenta just came out naturally, no help needed. With baby number two, I think that they did the abdominal massage without me really knowing what was happening. So I then started to say for baby number three, hey, I'd like to be warned if this is needed. And I do tell my students, my clients, to have that conversation earlier rather than later so that they're not taken off guard, they're not taken by surprise, and they have time to prepare, meaning they need to kind of breathe through that technique. But honestly, the most natural way is just for it to expel on its own with the signals that baby is giving by suckling. Okay. Now, what's baby getting at this young uh, phase of life? They've been born 25 minutes, maybe, for example. They've been born 15 minutes, up to an hour, 2 hours. What are they getting? Well, they're not getting milk yet, actually. They're getting what's called colostrum. Ladies, in the last couple of weeks of pregnancy, you might notice that you're able to express a little bit of colostrum out of the nipple early before baby even starts giving you contractions. And that's just a natural thing. That's what our breasts are already doing. But the baby's stomach is just the size of a cherry. Okay. So they don't need a lot of milk, but they do need the colostrum. Okay. The colostrum, they call this liquid gold. Okay. It has antibodies. It's kind of telling your baby's immune system what to be prepared for. Okay. Do you have a house with a million dogs? Okay. You have different antibodies from maybe a house that has no pets. Okay. Do you live in a house in a region of the country, for example, that has different allergens? Okay, than different areas of the country. So I went to school on the coast, and it doesn't get so cold there that a lot of the allergens in the air in nature are killed off. And so if I were to live there full time, I would have certain antibodies that are helping guard against some of these allergens than I would if I gave birth, say, more inland. Okay, so it's really important that the baby gets all of this. Okay, and there's kind of a certain code that is delivered from mom to baby through this colostrum. Okay, maybe mom um, is, I don't know, lactose intolerant, and maybe she's helping baby with some of these antibodies that are helping them be less lactose intolerant. Okay, so again, I'm not an MD, I'm not a bioscience major or anything like that, but I do know these facts about colostrum. It's really important, and so baby's only going to get a couple of drops, to be honest, every time that they suckle. Okay, but it's doing so much for mom and baby together. Okay, number one, it's telling mom to make more milk. Okay. And to start making this actual milk that will come in just a couple of days. Okay. Another thing that it's doing for baby at this point is it's starting to get the digestive system going. Okay, so baby's not taking water yet. Certainly, they're not taking milk, and certainly, they're not taking food yet. So, the digestive system has to get going in some way. And how do they do that? It's through the colostrum. Okay, it's telling the stomach to start digesting this colostrum, it's getting the intestines ready to start doing its work, their work. Okay, so one thing that the babies do ingest in utero is amniotic fluid. Okay, they practice swallowing with this amniotic fluid. Their intestines are practicing elimination. They are urinating in the amniotic sac, okay, which mom is processing through her urination as well. Okay. So there's lots of functions that are already kind of being practiced, but now it's the big day, right? It's the birthday, and baby really has to start doing this on their own. Okay. So the colostrum is kick starting that. Okay. So one thing is baby has to pass uh their first solid waste, okay? And they're certainly going to start urinating too. And one way to get all that amniotic fluid out of the digestive system is through this colostrum, okay? So you'll probably have already been told, and at least maybe through some of your other birth classes or maybe things that you're reading, is that babies' first stools that they pass are very dark, very sticky. And it's called the meconium. Okay, that's basically digested amniotic fluid, and it's very tough to get off. Honestly, you need a lot of baby wipes to get it done. I always let my nurses kind of teach me about that and handle those first couple diapers. I do remember my husband kind of standing side by side with the nurse team, and they were kind of showing him how to do it. That's probably the hardest one. Okay, and then after that, baby stools. Are very easy to manage. Okay. And they change in color quite a bit. Okay. So they go from very dark and sticky. People always say that it looks like maybe brownie batter. Okay. To something that looks more like applesauce in those next couple of days. And that's how you can tell that that meconium is all digesting through. Everything's working properly in their digestive system, and they're ready to start taking real milk. Okay. So that's one role that the colostrum, that's another role that the colostrum is playing there. Okay. Um, so I want you to think about being able to go ahead and start breastfeeding right away, even though it doesn't look like your typical breastfeed that you would see from a mom who has, say, a 2 month old, okay, or even a 6 week old or anything like that. Okay. So there's that. Now, I will say this too. Um, Ladies, because the act of suckling is signaling to our brain to signal to our uterus to continue to contract, you will feel cramping during the act of breastfeeding. Okay. So I want you to be ready for that. Okay. In fact, I had three completely unmedicated births, no pain medication or anything like that. The only time that I naively asked for pain medication was when I started to breastfeed. I just wasn't ready for it. I just didn't understand why I was feeling these cramping sensations and they were quite uncomfortable. It just kind of reminds you back to um, the menstrual cycle, okay, and the cramping that you may feel there. And then finally, I had to come to my senses and realize, you know what? I just got through a 24-hour labor with zero medication. I don't need a Tylenol to nurse my baby. Okay, so I had to kind of come back to center there. But it might take you by surprise. So that's why I'm making this video here so you understand that it is to come. All right, these crampings are there for a reason. They're necessary, but they don't always feel that great. So you're going to use your breathing techniques. You're going to take your deep cleansing breaths as these cramps start to kind of build in intensity and subside, just like childbirth uh, contractions, okay? Because your contraction in childbirth and labor is a uterine contraction, okay? Your cramping in your menstrual cycle are uterine contractions as well. And the cramping that you feel while breastfeeding are also uterine contractions. It's all the same thing, okay? They just vary in intensity and duration and frequency, of course. Okay, so be ready for that, okay? Um, I talked about how milk out equals milk in. So what you're going to want to do in those first, say, 24, 48 hours, 36 hours that you're in the hospital, if you have a hospital birth, is that nurses are really going to be looking for um, cues and signs that you're ready for discharge eventually after the typical, say, 3 day stay. And one of those cues that they're looking for, one of those milestones, is that baby has, say, between 6 and 8 wet diapers. Okay. And I think it's like 4 to 6 soil diapers. And they know that that is a signal that baby's taking the nourishment that he or she needs. Okay. So that's what you'll be tracking. Okay. So you might bring you might have it on your app already. A lot of these contraction apps will kind of evolve into now tracking your baby's diapers. So you might do that. Um, I just kind of found that I was going to make a little ticky mark on a piece of paper or a notebook. Some people might use the whiteboard that's in their hospital to make a little ticky mark because the nurse team will come in and say, hey, how many wet diapers has baby had in the last 2 hours? And how many soil diapers has baby had in the last 2 hours? So you're going to want to have that data for them. And that's why the apps, or at least tracking on paper, is going to be super helpful. Okay. Um, your baby will have kind of a little routine already going on. Not that they're completely like sleep trained or anything like that necessarily in the beginning, and they're still getting organized. Okay, they're going to be getting organized for the first like 2 to 5 years of life, to be honest with you. But in those first couple of days, baby will have somewhat of a routine, in that they're going to start squirming. Okay, they might pull maybe the hand to the mouth as maybe a hunger cue. They might be sitting on dad's chest and start to kind of do this with the head, and that means they're rooting for the breast. Okay. Um, Dad might be holding baby, and baby might be right next to dad's chest, for example, and baby starting to do this next to dad's chest. Okay. That means baby's hungry. Okay. Even baby just squirming and just being like, means baby's probably ready for a feeding. Okay. So go ahead and put baby to the breast at that time. Okay. In these early hours, okay, early days, it's you don't have to necessarily go front to back, or I'm sorry, side to side, and do left side and right side, but it is good to go ahead and try and get that routine going. Okay. Baby might only nurse for just a couple of minutes, up to maybe 20 minutes or so, and that's okay. It might just be a couple of minutes. It also might be that baby is kind of looking a little bit confused on latching. Okay, so you just want to stay at it. Okay, so again, we're going to put the nipple up to the nose, up to the top lip, or up to the cheek. Okay. As baby opens up, you're going to put the nipple in their mouth up to the roof of their mouth, actually. Okay. Your lactation consultant will give you tips on maybe cradling or supporting that elbow, for example. There's other ways you can hold baby. They're all illustrated very well in these editions of this book. Okay. There's what's called a football hold, a cradle hold. You can even kind of lie down next to baby. Um, and you can feed baby that way. Okay. So you'll start to kind of get a tiny little bit of a semblance of a routine going where a baby kind of squirms and indicates with some hunger cues. You'll feed baby. They'll pop off at some point, okay, and they'll become a little disinterested in feeding at that point, okay. And you're welcome to, at that point, just kind of look at them, cute, coo at them, hold them. You might practice burping a little bit, letting baby kind of have that wake period where they're just kind of a little bit of alert. They also might fall asleep at the breast. That's okay. Um, but we really want to get milk in as much as possible in these early days and these early hours. So if you find that baby is quite sleepy, as they typically are in those first, especially 2 weeks of life, then you might want to try a couple techniques to help them stay more alert. One technique is by making baby a little bit chillier than they might have been a few moments earlier. So, um, if baby's wearing one of the little caps from the hospital, you might take that cap off. You might also undress baby just down to their diaper, for example, so that they're a little cooler, so that they become a little bit more alert and they can feed. And then you can dress them again or just keep them skin to skin. Okay. So you might do that. Some moms also maybe tickle the bottom of their feet, that type of thing, so that they're a little bit more alert. I'll go into, after we bring baby home. I think I'll do that in a different video. But you might do that a little bit just so baby's a little bit more alert. But in those early days, that early couple of hours up to those first couple of days in the hospital, you're really just going to offer the breast as much as possible and allow that baby to practice and practice and practice feeding. Okay. I do encourage, especially dads, to remember to request that lactation consultant. Even if mom and baby are a rock star and they're doing amazing already, I still like the lactation consultants to come in, give you a couple of tips, even if it's just to pat you on the back and say you're doing great. But every once in a while, they might say, okay, let's get a better latch going. Let me give you some tips here. Let's get you situated a little bit higher up, mom. Let's get some pillows going. Let's hold baby in a different way. Okay, so they're going to give you some great tips. Every lactation consultant I've ever seen has been female, so there's a little bit more comfort there. Um, but ladies, you're going to have to just let them see everything going on. Okay, so you don't want to be modest in this case. You want to make sure that they can see what's happening, and they can give you the tips that you need. Okay. All right. So let's see. Let's go into formula for just a minute. Now, based on what you want, if you want to exclusively breastfeed versus if you want to maybe start to entertain formula, there's lots of debate on formula. And, of course, a lot of moms are going to, and doctors too, are just going to say, hey, fed is best no matter what. And I totally get it. If you really want to focus on making sure, though, that you have the right supply, you're going to want to feed often, of course. Don't worry about establishing a routine or anything like that. Don't worry about having baby sleep through the night. Certainly not in these first couple of weeks at all. We're not worried about that at all. We're going to wake up when baby is ready to feed and we're going to feed. Okay. But formula will probably be in a conversation at some point when you are still in the hospital. And a nurse might say, hey, let's go ahead and get the baby some formula now. Formula introduced early like this is kind of in the same vein as pacifiers. Okay. So the American Academy of Pediatrics, other organizations in healthcare and in newborn care have had the pendulum swing back and forth over the last couple of decades. Right now, this recording is in late December of 2024. They are no longer issuing pacifiers, for example, in hospitals. because they want the baby to focus on feeding. And I totally agree with this. In fact, I fought it a little bit with my second baby who was born in 2016 because she was a big crier and I just wanted to have a pacifier. But I do understand the rationale and I do think it is for the better. Okay. Same thing with formula. If we want our breasts and our body to make as much milk as possible and to be efficient in that, we want baby to really be able to latch to the breast rather than to a bottle's nipple, then we want to prioritize that. Okay. There have been cases, and with me as well, where baby wasn't latching um, as efficiently as possible early. Okay. So we needed some more practice, but I still wanted to get baby fed. One technique that you might use, ladies, is hand express colostrum. Ask the nurse for one of those tiny little pill cups, okay? And just express the milk into that little pill cup. And then you can feed that to your baby on the tip of your finger or even on like a little ice cream spoon, okay? Give that to them so they're getting the nourishment even though they might still be learning to latch at that point. So that's a technique you can kind of circumvent while baby's learning to latch, and they could still get that amazing nourishment from your colostrum. Okay, you'll notice that this colostrum is very thick. It's golden in color, maybe yellowish or orangish in color, and it's quite a different consistency than your actual milk that will come in a couple of days later. Okay, so it's the untrained mom. It's the mom that doesn't know that she might be just wondering why am I not making any milk. And what she'll realize is a couple years, I'm sorry, a couple of days down the road, that's when her milk comes in, especially if baby has been suckling the whole time. Okay. So a lot of times, and for me, certainly, um, after I left the hospital, so I had your typical 3 day stay in the hospital each time I had my baby. It wasn't until I came home, typically that day that I came home, that my milk came in. And what that means is all of a sudden, your breasts feel rock hard. Okay. And they feel very in what we call engorged, meaning they're just very big. And all of a sudden you realize that when baby is taking the milk, that it's light in color, it's much thinner in consistency, and there's a lot more. Okay. So that takes a couple of days to get used to, meaning you getting used to that, baby getting used to that, and also your breast getting used to just how much milk your baby is going to take. Okay. So one tip for that is that you might hand express as well a little bit, a few minutes, for example, or a few ounces, or maybe just an ounce or half an ounce before you put baby to the breast, so that it's not what we would like describe as like a fire hose for your baby. Okay. So you might express a little bit. And also hand expression is going to help soften that tissue. Okay. Because as you know from the male anatomy, okay, when his when his anatomy, okay, is full of blood flow, okay, then it has a very different texture than when it's not full of blood flow. Okay, so for you, when your breasts are completely full, when the milk ducts are completely full, your breast might feel rock hard versus when there's a little bit of milk released, then they become softer and your baby's going to be a little bit more comfortable there. Okay, so hopefully you're tracking with me there. All right. Um, so that might be a technique that you use, but the main thing with those first couple of weeks of life is you want to breastfeed often. Okay, just breastfeed often. Okay, you'll start to learn these cues from your baby. Okay, some of that discomfort, that looking around. Okay, maybe putting the hand to the mouth again. It's going to be cues to feed your baby. Go ahead and offer the breast, even if your baby just ate. Okay, you might feel very tired. You want to take a shower, something like that. You need to go to the bathroom. Okay, baby is offering hunger cues. Okay, feel free. You can express some of that milk. Dad can give the milk even on the tip of a finger, okay, or on a tiny little spoon just to drop it into the mouth until you're available. Okay. So we want to breastfeed early and often, and you're going to see more about that in the book. Okay. We're also going to be breastfeeding around the clock. Okay. Baby's going to eat every 45 minutes to say 2 hours or so. Okay. So, what I used to do was would be on my phone. I had an alarm for basically every hour around the clock. Okay. So, for example, if I fed baby at 12 midnight, for example, I would just go to my 2 o'clock hour, and let's say I finished, yeah, I finished feeding at like 12:15, whatever it was. Okay. Then I would just set my alarm for 2:15, okay, a.m., and just get baby up again and feed the baby. Okay. In those first couple of weeks, baby is very sleepy. All baby's going to do is just wake up, get changed, feed a little bit, go back to sleep. Okay, that's okay. All right. We want to wake up baby to feed in these first couple of weeks. Okay, we're going to wake them up. If they're still so sleepy, we're going to use some of those same techniques. We're going to undress baby. We're going to be in a cooler room, for example, maybe tickle baby's feet, okay, so that baby can wake up. Sometimes moms might even put baby's feet in underwater, something like that, just to kind of wake them up a little bit, okay, and baby's going to feed. Baby could fall asleep to the breast. That's okay. Maybe get baby up. Okay. Maybe pat her on the back a little bit, change sides, offer the breast again. Okay. So we're going to wake baby up to feed in these first couple of weeks. Okay. Eventually, your baby's going to get a little bit organized there in their routine, and they're going to start to naturally wake up and start to kind of squirm. Um, so that you can feed them. Okay. So a lot of parents, they're going to have baby in their same room. I'm not going to recommend that baby sleep with you in the bed for various reasons. I'm sure you've read all about. But having baby down the hall or in the same room is great because you're going to hear these subtle cues. Now, you'll note when you read some of these books that baby crying is like uh, the last sign of hunger. Okay, those first signs of hunger are very quiet. They're just kind of like type thing. Okay, that crying, that screaming crying that we always see on TV. Okay, that's kind of the baby's last resort. They're like, all right, I've already given you all these cues and no one's listening. So now I'm just going to let you have it. Okay, with my cries and my screams. Okay, so let's not let baby get that far along. Let's go ahead and feed baby when they first start to squirm. Okay, and let's not give a pacifier when they first start to squirm. Let's not um, give baby to Auntie Jen when they first start to squirm because maybe they just want a change of scenery. Let's offer the breast instead. Okay. That's why it's kind of difficult in the beginning to have a lot of house guests when you're first coming home from the hospital and baby's super young because you do need to breastfeed so often. And so when you have Uncle Bob in the room and you've got Aunt Jen and all these other people and all the cousins and all the nieces and nephews because they all want to see the baby, it can make things a little bit awkward. And sometimes mom can feel a little bit pressured that to instead of feeding baby or maybe leaving the room to feed the baby, leaving the party, to just offer a passy or offer a change of scenery or offer a new toy instead or go on a walk. So instead, I like to see the babies fed often and just around the clock instead. And then as baby gets a little bit older and you kind of know, hey, she's got a whole hour and a half probably until she needs to be fed again. Now we can go on a walk in the stroller. Now we can go out if you want to, go out for a drive, or now you can pass her around and let everybody hold her, put her on some tummy time or whatever and let her play, rather than kind of knowing, oh, she's hungry again. It's only been 35 minutes. I just fed her and she's giving me hunger cues again, but everyone just got here and they want to all hold the baby. So let's not succumb to that pressure. Let's go ahead and put baby's priorities first. I promise you it'll pay off in the end. Okay. It'll pay off with them being a little bit more organized, a little bit more early. Okay. And then you can have everybody over and they can give you all the gifts and all the attention that you and baby need. It's really for the baby, actually, that they're going to give the attention. Okay. So let's talk about a little bit further down the line, though. As you get, baby gets a little bit older, then you'll have a little bit of a of a routine, like I was alluding to. Baby will wake up and you'll typically change the baby at that point. Okay. You'll feed the baby, offer both sides. Okay. They'll probably be very hungry. Okay, feed a lot maybe on one side and then just kind of have a little snack or a little dessert on the second side. And then maybe that next feeding you start on that other side and then you go back to the other side. So you're going to kind of go back and forth there after they feed, then instead of going straight back to sleep like so many do in the early weeks, they're going to have a period of wake time. And that's when you can put them on their back, maybe on a little mat on the living room floor, and you all can uh, play a little bit and you could talk to your baby. That's when baby starts to kind of explore the world around them. They're going to find their hands. They're going to start feeling things, and they're going to start maybe looking at your face and looking around. And then as they kind of end that playtime, then you'll probably end up just putting them back down for another nap. Okay. Um, and then you'll have a little bit of time to take a shower and brush your teeth and visit and just kind of have some time to yourself. And then they'll wake up again. Of course, in those early weeks, you're going to wake them up. Otherwise, they're going to start to wake up. And again, they're not going to wake up with a full-blown scream. More than likely, they're just going to start to squirm. That's when I like to get them up and go ahead and feed them so it doesn't turn into crying. Okay. So again, it's going to be a kind of a wake period. They go down for a nap, and then I'm sorry, they're going to wake up, they're going to feed, okay, they're going to have a little bit of awake time and play, then they're going to go back down for their nap. Okay, so I hope that was clear. Um, okay, I want to talk about some good techniques when it comes to safety at home. So I'm going to leave that for another video, but my main goal here is to definitely read about breastfeeding, okay? Get some good information on there. Make sure you see your lactation consultant before you leave the hospital. And then once you are at home, ladies, let me give you a couple more tips here. Dads, I want you to be observing and supporting your wife as she is breastfeeding. So, meaning when she's breastfeeding, I want you to ask, hey, can I bring you your water? Can I bring you a quick snack that you can snack on? Have your phone charger there so you can kind of look at some things while baby's feeding if you would like. Have some books there if you would like. Make your breastfeeding areas like your throne. Okay, I want you to have the most cushy little easy chair if you would like. I want you to have it be very comfortable. Put some plants there, put it by a window. Okay, I want you to really sink into this and really enjoy this time with your baby. It can really be just such a sweet time of bonding. Okay. So I want you to think about that and maybe have a couple of places that you feed. Okay. So there might be one place, say in your room where you have a nice comfortable glider or a chair. Then maybe have one in the family room. Okay. So when it's just you and your husband or you and the other kids, for example, you can feed and be very comfortable and you've got everything that you need there. Okay. And then maybe also have, if you want to have it in, say, a guest room or a back den, for example, or back in your bedroom. So that way, if you do have guests over and you don't feel quite comfortable feeding right there in the living room, that's totally fine. That was always me. Then I just excused myself and went back to my bedroom to feed. Okay. So you want to have comfortable places there. Okay. Also to accept the food that people offer to send to you because that's great when you don't have to cook for a couple of weeks, up to a couple of months. It's great because then you just put something to heat it up and you can eat. Let me take a couple of notes, or let me make a couple of notes for you for these nighttime feedings. Okay. So, one big rule is that we don't ever want to fall asleep feeding. Okay. And that's why I always recommend to my students. Now, you talk to your doctor, you talk to your midwife, you talk to your professionals, but I always encourage my students to physically get up out of bed. Okay, in those early months, okay, before baby can really move their head around, really roll over. I want them out of the bed, okay, and I want you in your easy chair feeding, okay. We want to be able to wake up enough, ladies, to be conscious enough to finish our feeding and put baby back down in their own bed to sleep, and then we go back to sleep. Okay. We don't want to bring baby into our bed with us. It's 3 a.m., for example. It's 4 a.m., for example. And we're so sleepy. We feed baby and then we fall asleep. We don't want that to happen at all. So we want to be able to wake ourselves up enough. And so this day and age, a lot of moms are going to just kind of look at their phones because that's going to wake them up enough. They might put a show on or something like that because they want to be awake enough so that they don't fall asleep so they can put baby back. Okay. My husband and I always had a little routine. So my alarm would go off at that whatever hour it was. I nudged him. Okay. He would always go get the baby. Okay. Change if the baby needed changing. Bring me the baby. He fell back asleep. I would get up and I would go to my chair and feed the baby. And then I put baby back. And then I would go back and sleep for another 2 hours or so. Okay. I'll tell you, just like after a contraction, that period of time where you're not having any contractions is like the sweetest time ever. It just feels so good and so relieving. Just like that, that sleep you have after you put that baby back down to sleep is like the sweetest sleep you ever get. Okay. It's like just amazing sleep. Okay. So I want you to think about that and really have a kind of a logistics plan so that you can do that. Now, as your baby gets older, up towards, say, a couple of months, 6 months, and so, I felt more comfortable feeding the baby in my bed, and that's a personal decision. But that was well after baby was strong enough to even take a blanket and pull that blanket down. Okay, so it's in those first couple of weeks that we really want to avoid that. Okay, so let's think about that. I'm going to make another video on some other best practices at home once baby gets home, but this was really just to focus on those first couple of hours up to those first couple of weeks of life in breastfeeding. Okay, so I hope that that has helped you. Please reach out with any questions or comments. I'd love to learn more about your experiences, and we will talk soon. So again, it's Rachel with Drug Free Birth, and thanks for watching.